Good morning from Toronto, everybody. This is Arifa Muzaffar from Toronto, and our website is www.eawaz.com. I have my guest with me, and that is Dr. Anthony Leeds, all the way from England. Dr. Anthony Leeds doesn't need any introduction. Of course, he's an author, he's a medical practitioner, he is a researcher, very many things. And he's a senior research fellow, Parker Institute, of course, Health Sciences, International Medical University, Kuala Lumpur, Malaysia, and then University of Copenhagen, so many other universities. The one thing what I would say is our programs are based on weight gain and all the problems associated with the weight gain. Dr. Anthony Leeds, his current research interests concern the use of low energy diets, particularly total diet replacement in the management of obesity and obesity related problems. And of course, I definitely thank him very much. Dr. Anthony Leeds, I welcome you to show. Good afternoon from Toronto.
Hello, hello. Good afternoon. Thank you.
Thank you very much. Now, these programs, you can watch these programs on our website, which is www.eawaz.com, and there is a health section. Of course, these are programs related to our health, our weight gain, our diabetes, osteoarthritis, sleep apnea, and so many other things. There is nobody better than Dr. Anthony Leeds who can talk about this. Now, Doctor, now would you please introduce today's topic?
Thank you very much indeed. Well, today we're going to talk about sleep, and sleep is obviously very important. Without it, we wouldn't be able to survive very probably. But one of the problems has been that over the last 20, 30, 40 years, people are sleeping less. To some extent, it's because we are distracted by the various electronic devices that we have. But we also know that being overweight and obese does actually have an effect on sleep. Now, there are different types of problem with sleep that can occur with being heavy, but the main one that causes a great deal of trouble is so-called obstructive sleep apnea, which is a condition where the individual suffers from relaxation of the muscles at the back of the throat at intervals during sleep, and this means that they stop breathing for a very short period of time. Now, the studies that have been done show that everybody does this to a very small degree during sleep, but it's when the frequency of those stops in breathing actually take place that it becomes more of a problem, because when that happens, the oxygen in the blood goes down, the blood pressure goes up, and when it becomes a very serious problem with many, many episodes of stopping breathing, then they really do have either moderate or severe so-called obstructive sleep apnea. And we know that this can cause problems in relation to feeling sleepy during the daytime, falling asleep while performing important tasks. It's particularly dangerous for people who undertake operating machinery at work, or also drivers. And throughout Europe and North America, and indeed in Australia and New Zealand, and indeed in Asia, it's been noted that obstructive sleep apnea can be a serious problem for commercial drivers, those who have to drive lorries and public service vehicles, buses, trains, and so on. It's not possible for them to be in a state where they are likely to fall asleep while driving. Now, falling asleep while driving tends to be associated with the more severe end of the condition, but just falling asleep while sitting, relaxing, can sometimes be just a natural event, but it can also be a sign. Now, the other issue is that not having proper sleep tends to have effect on mood, so people can become depressed. So there are a whole range of consequences of the condition. And in the longer term, as a result of the rises of blood pressure that occur, it can be a factor that drives high blood pressure. It can increase the risk of heart attack and stroke. And so you can see that this is something which we need to be able to detect and also to be able to treat effectively.
Thank you very much. You mentioned about the commercial vehicle driving and all of that, but I think so if somebody is driving his own car, every driver is responsible for his life and others. If somebody has these conditions, with a little mistake, we can harm others. Now, before getting into that, Dr. Anthony, my question is, why sleep is important? What is the role of this sleep or nap in our regular life? I mean, does it reset our body, or does it affect our hormones in any way, shape, or manner?
Yes. Yes. So sleep is very important in order to function normally during waking. And recently there's been a tremendous focus on the way in which the immune system recovers during sleep. And experimental work shows very clearly that those who are deprived of sleep have depressed immune function. And respiratory physicians have recently been discussing the importance of this in relation to the current COVID-19 pandemic. And so one of the important things in relation to this is that people should ensure that they get enough sleep, purely for the fact that they ideally should have the optimal immune function. But we also know that sleep interacts to some extent with weight, and people who don't get enough sleep, or as much as they should, perhaps tend to eat more. And certainly in my discussions with my own patients, when I'm asking the history, I find out that they sit watching films on the television or on other device in the evening. And of course, during that time, they're snacking. They're also receiving blue light from the television or the machine, and that tends to keep them awake. So generally, we would advise people to avoid using screens, or to have the program within the device that makes the screen go yellow, or indeed, as was made by a comment made by a respiratory physician recently, it is possible to obtain slightly yellow tinted glasses and wear those towards the end of the day so that the stimulation is not received. So all in all, I think it's important to recognize that sleep is important, particularly at this time, but always has been, in relation to immune function, in relation to calorie intake, and also, of course, in relation to heart disease risk, because we know that people who don't get as much sleep do suffer from an increased risk of cardiovascular disease.
Thank you very much. Now, in a regular life, do we get, with all these devices around us, do we get enough sleep, and how much sleep is required for a normal human being?
I think the answer is that surveys done in various populations in different nations show that over the last 20 or 30 years, the number of hours of sleep on average that are being taken is less than it was, say, 20 or 30 years ago. I think that the tremendous technological advances that we have seen over the last 150 years, that the introduction of electricity into homes, I think, showed us that with artificial lighting we could stay awake longer. Now this is interesting because you remember in the past, of course, when we had oil lamps or candles, there was a tendency perhaps to go to bed soon after it got dark and to wake up when it was light. And now, of course, our entire diurnal pattern evolves around our ability to use artificial light, which is good in some ways, but of course not optimal as far as getting enough sleep is concerned. So the introduction of electricity, a tremendous advantage to us in our civilization, but at the same time, as with everything else, if used excessively, may not be too good. And then, of course, electronic devices, introduction of television. First transmission of television, of course, was, I think, in the 1930s, but effectively commercially was from the mid-50s. And then since then, of course, the actual sheer amount of material is overwhelming, and most individuals have access to vast amounts. And we now have the situation where I've heard of individuals who, as they say, binge watch on 4 programs or 4 major films in one evening, which is an extraordinary thing. I'm not sure that I could do that or would indeed want to, but it does mean that people are spending so much time doing this. While they're sitting, of course, they're also physically inactive, and we know that physical activity has to be sufficient. So maybe we've gone a little bit too far, and maybe we need to move back to being a little bit more moderate with our use of all these wonderful inventions that we have around us.
Wonderful. While you were talking about this, I thought about something. In all the seasonal fruits and in flowers, the flowers and fruits, it depends upon the day of length or day of night where that stimulates or gives them the when to bloom. So this means in the human life, of course, sleep is very important. What is obstructive sleep apnea?
Okay, so obstructive sleep apnea is where the back of the airway, back of the throat, relaxes and breathing stops for a short period of time. Most individuals do this occasionally during breathing at night when asleep, but those with the condition, it occurs too frequently, and the consequences are that the oxygen in the blood goes down, the blood pressure goes up, and they may well feel not rested when they wake up. They may feel there may be mood changes. They may well fall asleep. This may be a minor problem if it's relatively mild, moderate, and they may just fall asleep when sitting and relaxing. But falling asleep while undertaking operating machinery in a working environment or driving is the serious issue. So it's something that respiratory physicians have been working really hard over the last 10, 20 years to identify individuals and to run public health information programs. There's information on the websites in Canada, in India and in Pakistan, and we're going to give the links to those at the end of the program. The surveys done in Canada show that overall, over the adult population, about 3% of individuals in the adult population are affected by obstructive sleep apnea. But it's something which affects older people. So above the age of about 45, it may be 5% of the adult population. And then among those who actually have the condition, the majority are older people over age 45. However, as I've said already, being heavy and overweight and obese has an effect and increases the risk. And the heavier an individual is, the more severe the obstructive sleep apnea. And as I think I mentioned previously, I've worked with surgical colleagues in helping to prepare individuals before they go in for bariatric surgery. And some of those individuals are very heavy indeed. And of course, they are affected by obstructive sleep apnea. It's a very serious issue. Many of them will be getting the standard, gold standard treatment for this condition, which is to use a continuous positive airway pressure machine, which is something that is worn over the nose and which blows air at a slightly higher pressure into the airway to hold the airway open during sleep. This is the gold standard treatment. However, we have to go back one step and ask the question, well, how does somebody know whether they have this condition and that they need to actually seek help? Now, again, at the end of the program, you'll see links. And I've given links for Canadian, Indian, and sources in Pakistan. But I've also given UK links to 2 online questionnaires. And these are the ones which are very often used by respiratory physicians. One of them is the so-called Epworth scale. And you answer questions about the conditions under which you fall asleep, whether it's just sitting, whether it's talking to somebody. Obviously, if you're talking to somebody and you fall asleep while talking, that tends to be rather severe. You get a score, and if your score is above a particular level, in fact around 10, then the recommendation is that you go to talk to your general physician, who in turn may well refer you for a test. So finding out, first of all, whether you have the problem or not is the first step, and a screening test online is the first step. There's also a link to another one called the Stop Bang questionnaire, which is one where there are a series of questions about the conditions under which you fall asleep, but also whether you are a man or a woman, because men are affected more than women, what your weight is, whether you have high blood pressure, and so on. That one asks those questions. Fill it in on the screen. If you get the score above 3, it again recommends that you should seek guidance from a physician. And as I've always said, everything that we say on this program is general guidance, and it's always important to seek advice from your general physician in order to ensure that it is individualized guidance that's given. So if you get a high score on those questionnaires, you need to go and talk to somebody about it.
Thank you very much. What is the duration of deep sleep required, and for the different ages, is it different?
I think there certainly is a variation, but as far as this condition is concerned, the key thing is that people are not getting sufficient of the deep sleep, and this is why they mood changes, their concentration. There are a number of higher functions that are affected by the pattern of sleep which occurs. Now, I did wonder whether I should show you some examples of sleep studies, but I haven't done so. Maybe we can put them on the website or put a link to one of the sleep associations which has got these on there. But there's absolutely no doubt that having this condition where breathing actually stops has a quite serious effect on the duration of deep sleep. First of all, duration of sleep is not as good, and also the quality of sleep is impaired. And having found that an individual might have the condition, they should seek guidance. They may then be referred for a sleep study. These can be done in a special sleep clinic overnight, or now we have instruments that people can take home and do the recordings at home, and then the recording is read in a specialist centre. So it's much easier now to find out whether people are having disturbed sleep or not. And then also we have the gold standard treatment, the CPAP. CPAP works very well for many people, but doesn't work for everybody. Some people find it very uncomfortable. The airway may become, the nose may become uncomfortable, and some people do struggle with them, which is why in terms of lifestyle guidance, we always say that it's very important to ensure that if somebody is overweight or obese, that they should lose weight. They should exercise. If they smoke, they should stop smoking, ideally. And they need to be careful about the use of alcohol, perhaps not drink so much, certainly later in the day. And then also avoid medications for sleep, because in fact those sleep medications often make sleep apnea worse. So those are the general points of guidance. Now, when we come to losing weight, part of the reason why you've invited me to talk about this is that colleagues in Sweden have undertaken work using the type of diet that interests me. And as you know from the previous programs, I'm particularly interested in the use of formula diet to achieve a good initial weight loss before moving people towards weight maintenance. That initial weight loss is achieved by removing all normal food, conventional food from the diet and replacing it with formula diets, soups and shakes, delivering just about 800 calories per day. Now, this may seem very low, but we've shown experimentally that it can be done very effectively and very safely. And colleagues in Stockholm in the Obesity Institute used this type of diet and showed very clearly that in men with moderate and severe obstructive sleep apnea, that they would get a very good weight loss. It was around 17 kilograms on average, and they then achieved a very large improvement in their obstructive sleep apnea to the extent that half of them no longer needed to use their machines afterwards. Of course, once they'd lost the weight, they needed to maintain it, and they were managed by dietitians in a specialist unit. They maintained their weight for a year, maintained a large proportion of their benefit. In addition, as I'm sure you know, this condition is generally often associated with measures of adverse cardiovascular risk, and also is associated with diabetes. And the measurements of blood pressure and in some cases some of the other variables that are important for cardiovascular risk improved as a result of the reduction of weight, as you would expect. So for example, the blood lipid profile improves with that amount of weight loss, a dramatic improvement in blood lipid profile. Blood pressure goes down and stays down if the weight loss is maintained. So what we know, and it's very important to bear in mind that in many of the areas where this type of diet has been shown to be effective, we are yet to be able to roll these out to be available. However, as I said previously, this type of diet is now being rolled out in the United Kingdom, in England and in Scotland, in order to achieve diabetes remission. We're not yet rolling it out in the UK in relation to obstructive sleep apnea. The emphasis on weight loss in the UK is not particularly great in obstructive sleep apnea, whereas in Canada and also in the specialist centres in India and Pakistan, weight loss is emphasised. There's no doubt, and I have seen this in my own practice in working in a medical bariatric clinic, helping bariatric surgeons to prepare people before surgery, that a weight loss of 15 kilograms will improve the obstructive sleep apnea, and the anaesthetist will be very pleased that a patient has lost 15 kilograms before going into surgery, because they will be very much easier to anesthetize during the surgery and manage after the surgery. So there's little doubt that this is a good thing. It maybe needs a little more investigation, but the evidence is already very good. So losing weight in an individual who is overweight or obese who has obstructive sleep apnea is part of the core management of the condition.
So the punchline is, if you lose your weight, we can improve our sleep quality and we can improve our efficiency to work. So what are the actions needed to improve sleep quality? Weight loss? Anything else?
Well, exercise. If we're talking about somebody with obstructive sleep apnea or somebody who doesn't have it, I think the so-called sleep hygiene is important. Let's talk for a moment about individuals who do not have a specific sleep disorder. Now, this is interesting because one question that is not yet answered by the scientific evidence or the investigations is whether heavy people who do not have obstructive sleep apnea, do they actually have impaired sleep? Now, from all my many conversations over the years with people who are heavy and then who lose weight subsequently, my belief from these series of anecdotal observations is that when people lose enough weight, they actually get improved sleep. Now, because we don't have the experimental evidence for that, I've asked colleagues in Copenhagen to actually undertake studies in which they're looking at sleep duration and quality, and I think that within a few months we're going to have some evidence which will be useful there. So if we then ask the question about people who are not heavy but are perhaps not getting enough sleep, the standard questions would be asked, and that is, are you managing your life well in relation to trying to get good quality sleep? So that relates to what you do before you go to sleep. Are you tapping away on your laptop until you fall asleep exhausted? Are you watching a film on your iPad or your phone right the way through, and you can't stop because you want to get to the end, and it then ends at 1 o'clock in the morning when you know you have to get up at 6 o'clock or 7 o'clock to go out or to attend a meeting and so on. So managing the evening, managing the lighting, white light, is not a good thing for the domestic environment in the evening. It would be better if it's a yellower light. Now, you can now get some very sophisticated LED lighting where you can control it with little devices that look a little bit like this one here that I have, that I control my lights here. Those are available for domestic use. And you can change the light temperature from the very white light, which is that which you see from the bright sunlight, through to a much warmer light. So in the evenings or before sleep, our homes should be lit with yellower light rather than dark light. When we look at our screens towards the end of the day, if we want to do that, then we should be looking at slightly yellower screens. Now, again, in the last few days, I've heard a respiratory physician saying you can use yellow spectacles. Now, I know I have a pair of them somewhere in my office here, but I've got so much stuff here that I'm not sure that I could find them. But there are yellow spectacles that you can put them on over your normal spectacles if you wear spectacles, and all the light that you see then is slightly yellow. That's another option. But the other thing I think is discipline. In relation to timing and what you do, making sure that you allow time. And if people say, well, I have to get up very early, when you've got to back calculate and then make sure you go to bed in time to get enough sleep. The light, no lighting in the room, right temperature. If the temperature is too hot, then it's not a good thing. It needs to be relatively cool. And the food, not to eat too close to going to bed, probably avoiding alcohol. The evidence is that it's probably a good idea not to eat too much of a high protein intake within a few hours before going to bed. It's better to consume carbohydrate drinks, for example, in the few hours before going to bed. There are studies that look at all of those issues. So that was a very long answer to your question. Sorry about that.
Not a problem. I think we'll have one full program on this, that what are the key actions needed to improve our sleep quality. Anyways, I thank you very much. Now I think all the information is given and the links are given at the end of the program. You can click those links. These are live links, and you can get all the required information. And I thank Dr. Anthony Leeds for all this effort. Thank you very kindly, Doctor, and we'll be looking forward to seeing you next week, talking to you next week.
Very much.
Thank you very much. This is
Thank
Dr.
you.
Anthony Leeds. Of course, I definitely wanted, time doesn't allow, that what should I do? What should I eat? He gave some of the ideas though, but anyways, I'll see you next week. Till that time, have a safe and sound weekend. God bless you. Allah Hafiz.